So I am on the web page for the BCRF, which is a non-profit organization that is intentional about conducting breast cancer-based research. And I'm reading the article titled "Black Women and Breast Cancer: Why Disparities Persist and How to End Them." This is an article that was published this year in February 2024. Credible information, so feel free to share that which I am saying on about this conversation today. So, what accounts for breast cancer disparities among Black women? The gap in breast cancer incidence and outcome among Black women is complex and multifactorial. Social, economic, geographical, and lifestyle factors may partially account for disparities. Black women are statistically more likely to have diabetes, heart disease, and obesity, and are less likely to breastfeed after childbirth, all of which are risk factors for breast cancer. They are more likely than white women to have inadequate health insurance or access to healthcare facilities, which may affect screening, follow-up care, and completion of therapy. Working towards a solution. According to the National Cancer Institute, disparities in cancer care can be improved in several ways. These include creating statewide cancer screening programs that are accessible to underserved populations and by addressing their biological differences in breast cancer across racial and ethnic groups. A 2019 study that analyzed characteristics of breast cancer patients on a city level showed that women with more resources, such as education and income, may be better equipped to take advantage of healthcare advances. Indeed, cities that have confronted this problem by increasing access to state-of-the-art mammography facilities made significant progress in narrowing the breast cancer mortality gap between Black and white women. The biology of breast cancer is inherently complex, which is why we often hear the phrase, "every woman's breast cancer is unique." While we have made significant progress in understanding the molecular drivers of breast cancer, most studies and clinical trials are conducted in white women. Expanding Black women's participation in research is critical. We have only recently been able to decipher some of the underlying biology to explain the higher incidence of aggressive tumors in Black women and to identify biomarkers that could ultimately inform personalized therapies and improve outcomes for Black women diagnosed with breast cancer. So I think one of the key things that I'm hearing from this particular section is that there has been not enough Black women participating in clinical trials or studies. So there is an intentional, deliberate strategy to expand Black women's participation in research, right? And this is also considering what they're saying here, this idea that every woman's breast cancer is unique. Every woman's breast cancer is unique, right? Let me see what else I can find here in terms of what this organization does in context to breast cancer. All right, so in context to the BCRF's global reach, in 2024, the World Health Organization announced that breast cancer is the most frequently diagnosed cancer globally in women. According to a recent report, 2.3 million women have been diagnosed with breast cancer, and more than 670,000 women have succumbed to the disease, making global breast cancer research even more critical. BCRF investigators are addressing healthcare inequalities around the world with a particular focus on Black women in low-resource areas. These studies have the potential to inform strategies to improve outcomes in underserved communities globally. Right? So there's a global aspect to the BCRF. They also conclude here in this article that addressing and improving Black women's representation in breast cancer clinical trials is critical to assuring equity in care.